Pre-herpetic neuralgia. Pre-herpetic neuralgia. This is not post-herpetic neuralgia. Without further ado, let's go. Neuralgia means nerve pain. Herpetic, in this case, herpes zoster virus. Pre means before. So, we are talking about before the full appearance of signs and symptoms of herpes zoster virus, we have nerve pain. Why this presentation? It is necessary because we run into wrong diagnosis with pre-herpetic neuralgia. Is going to present in such a way that the patient will be having localized pain. Many investigations would have been done. Time and money would have been wasted. The patient will continue to suffer. Yet, no definitive diagnosis. Results are coming back after CT scan, cardiac enzyme assay, ultrasound, X-ray. Everything is coming back negative. Yet, no resolution. We're not going to blame anyone for making wrong diagnosis here, but this presentation will be helpful because no rashes yet. However, simple history of past chickenpox in this man or woman in the past, maybe when he or she was a child, will help, will give us the clue. Because no more rashes for many years. And today, at the clinic or emergency room, no rashes. But he or she is having localized pain. Sometimes it could be diffused. The pain will be in a particular dermata. It could be regional. Still on clinical features, the pain might be mild. Many times could be severe. There might be other associated symptoms like headache, fever, malaise, fatigue, and so on. Days after, we might pick rashes, but we may not. And when we pick rashes, it might not be localized to where he or she is having pain. The rashes can occur in other parts of the body. If we don't have rashes at all, that's another definition. When we see the rashes, we then know, oh, this is herpes zoster virus. After the history of chickenpox, right? Okay, we're dealing with shingles. But before we were able to pick rashes, we've made the wrong diagnosis, and we're not faulting anyone for that. Because when this pain is occurring in chest region, we're bound to want to rule out terrible conditions like myocardial infarction, which is heart attack, pericarditis, myocarditis, lung-related problems. No, we just do gamut of investigations, but results will be back. Nothing significant, all negative. If it's localized to abdominal pelvic region, we'll be ruling out peptic ulcer disease, diverticulitis, appendicitis, no biliary colic, no renal colic, nephrolithiasis, ectopic pregnancy if she's a woman. Imagine the level of investigations that will be done, only because we've not taken history of chickenpox in this woman, and we're not faulting anyone. When anyone is having pain in this region, we have to rule out, all these terrible conditions. Now, if we are fortunate enough to have rashes later, good, but sometimes we don't. So days after, what I was trying to say is days after the woman or man had presented with localized dermatoma pain, Then we'll pick rashes: erythematous, papular, vesicular, bullous, pustular. Sometimes we may never see any of this. So if no rashes at all, then we're dealing with another entity entirely. This is known as zoster sign herpetic. This is for another day. Now, how can we make a definitive diagnosis of pre-herpetic neuralgia? Let's pause, rewind back to the clinical presentation. We will do physical examination and then do serology. IgM will tell us if this is a fresh varicella zoster virus infection. IgG will point to a long-standing condition. We can have biopsy, but not commonly done. It's rare. If we are able to pick vesicles, we can swab the blisters for polymerase chain reaction. Other vesicles or pustules, just have swab for polymerase chain reaction to get definitive diagnosis of varicella zoster virus, herpes zoster virus. Once the diagnosis has been accurately made, treatment is easier. Analgesics, antiviral agents. Other agents, depending on what is available in your country or jurisdiction, could be corticosteroids, gabapentin, oxycodone, and so on. The question is, why this presentation again? And my answer is simple. Because we do make wrong diagnosis when it comes to pre-herpetic neuralgia. And we just have to remind ourselves, the patient is presenting with a localized pain. Before running into so many different investigations, why not the history of chickenpox in the past, so that we can add the appropriate investigations that will point to varicella zoster virus infection on top of whatever we're thinking. That will save us from time and money wastage, because the patient will continue to suffer. Yet, all investigations have been done, or possible investigations done: CT scan, chest X-ray, serological investigations, so long, everything, blah, 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 cardiac enzymes, all coming back negative. Or haven't you had situations where patient will say they did everything, they found nothing wrong with me, yet my pain has persisted? It might be pre-herpetic neuralgia, and we will not get resolution until it is done rightly. Let's do just one thing. Let's take the pain to ask about the past history of chickenpox. Once that is taken, in anyone with localized pain, that will help us greatly. With the positive history of chickenpox, we can start thinking of pre-herpetic neuralgia, and that will help us as per the appropriate investigations that we can do quickly before wasting the time and money on big investigations. Then the patient could be out of the trouble, we can be happy, and the patient will be happy as well. With that, I've come to the end of this presentation as per pre-herpetic neuralgia. Just simple question: as per past history of chickenpox, will solve the puzzle, and the patient will waste less money and time, and will get definitive diagnosis. Please share with all your friends.